Assalamu alaikum students, I hope you are well. Today we will discuss about the medical nutrition therapy of liver diseases. First of all, we will discuss about the function and the structure of liver disease. Structure of liver. Weight of liver is 1500 gram approximately. Lobes of liver. There is a two lobes of liver, which is left and right lobe. Right lobe location is anterior and posterior segments. The right segmental fissure, which cannot be seen externally, and it separates the segments. Left lobe, the externally visible falciform ligament divides the left lobe into the medial and lateral segments. Next, we will discuss about bile. What is bile? The liver has a system of blood vessels and the series of bile ducts. Bile, which is formed in the liver cells, exits the liver through a series of bile ducts that increase in size as they approach the common bile duct. Bile basically is a thick, viscous fluid which is secreted from the liver, stored in the gallbladder and released into the duodenum when fatty foods enter the duodenum. It emulsifies fats in the intestines and form compounds with fatty acids to facilitate their absorption. Next, we will discuss about the function of liver. Functions: the liver has the ability to regenerate itself. That's why many of the people donate half of the liver. The liver is integral the most metabolic functions of the body and perform more than 500 tasks. The main function of the liver includes metabolism of carbohydrates, proteins, and fats. As we know, carbohydrate is the major source of energy. Liver also store and activation of vitamins and minerals, formation and excretion of bile. And it's also function of liver is conversion of ammonia into the urea. Metabolism of steroids, and the liver is also function is to detoxification of substances such as drugs, alcohol, and organic compounds. Bile salts. Bile salts are metabolized and used for the digestion and absorption of fats and fat soluble vitamins. As we know, fat soluble vitamins are A, D, E, and K. Bilirubin is a metabolic end product from red blood cells destruction. It is conjugated and excreted in the bile. And then we will discuss about the diseases of the liver. Here is the many of the diseases. Diseases of the liver can be acute and chronic, inherited or acquired. First of all, viral hepatitis, which is A, B, C, D, and E. Then non-alcoholic fatty liver diseases. Then alcoholic liver diseases, glycostatic liver diseases, cirrhosis, and end-stage liver disease. First of all, we will discuss about viral hepatitis. Basically, viral hepatitis is a widespread inflammation of the liver, and it's caused by various hepatitis viruses, including A, B, C, D, and E. Hepatitis A and hepatitis E are the infectious forms mainly spread by focal or oral route. Hepatitis B, C, D are the serum forms that are spread by blood and body fluid through. Vaccines. There are vaccines only for hepatitis A and B are available. However, recent advances have resulted in effective antiviral drugs to treat chronic hepatitis B and C. Then we will discuss about non-alcoholic fatty liver diseases. Non-alcoholic fatty liver diseases, NAFLD, is a spectrum of liver disease ranging from steatosis to steatohepatitis and cirrhosis. As we define as steatosis is the common condition caused by having too much fat built up in your liver. This is called steatosis. Steatohepatitis is a type of fatty liver disease characterized by inflammation of the liver with concrete fat accumulation in liver. And the cirrhosis is that basically end-stage liver diseases in which all part of the liver is failure or damage. It involves the accumulation of fat droplets in the hepatocytes and can lead to fibrosis, cirrhosis, and even hepatocellular carcinoma. Causes of NAFLD. The main cause of the NAFLD can include drugs, unborn errors of metabolism, acquired metabolic disorder, which is type 2 diabetes mellitus, obesity, and malnutrition. However, NAFLD is associated most common with obesity, type 2 diabetes mellitus, dyslipidemia, and metabolic syndrome. The initial stage of non-alcoholic fatty liver disease is non-alcoholic fatty liver, which is characterized by the simple accumulation of fat within the liver. Basically, in this stage of NAFLD, is simply accumulation of fat within the liver. Non-alcoholic steatohepatitis (NASH) is associated with hepatocyte injury with or without fibrous tissues in the liver. Steatohepatitis is a type of fatty liver disease, basically which is characterized by the inflammation of the liver. Non-alcoholic steatohepatitis can develop into chronic liver disease and non-alcoholic steatohepatitis cirrhosis. The progresses into cirrhosis. Cirrhosis basically end stage of the liver disease in which almost all liver is damaged. Cirrhosis is a variable depending on age and the presence of obesity and type 2 diabetes, which contribute to a worsening prognosis. Treatment and recommendations. The treatment recommendation for NAFLD from the American Association for the Study of Liver Diseases include weight loss, insulin sensitizing drugs such as thiazolidinosides and vitamin E. Based on the ASLD guidelines, a 3% to 5% weight loss can improve steatosis. But up to 10% weight loss may be needed to improve necroinflammation. Emerging data suggests drinking caffeine is productive against NAFLD. Vitamin D is recommended without diabetes. Alcoholic liver diseases. Acetaldehyde is a toxic byproduct of alcohol metabolism that cause damage to microcardial membrane structure and function. Acetaldehyde is produced by multiple metabolic pathways, one of which involves alcoholic dehydrogenases. The pathogenesis of ALD progresses into 3 stages, which is hepatic steatosis, alcoholic hepatitis, and last is cirrhosis. That's all for today. And then we'll discuss about next lecture. Thank you.